So welcome to today's webinar. I'm Charlotte, I'm the Patient Advocacy Manager here at Leukemia Care, and I will be chairing today's meeting. Today we're here to discuss shielding, less about the sort of practicality of shielding and more about the psychological and emotional impact that shielding for the last nearly 12 months now for some people has had, and to gain a bit of advice on how to cope with that for however longer it may last, hopefully not for too much longer. So I'm joined by a great panel today. We've got two patients and two professionals here to discuss the topic with us. To start, I'm going to hand over to Dr. Pauline Aiston, who's going to give us a quick presentation overview of shielding and what challenges that may bring you and how to cope with those. So Pauline, over to you. Do you want to start by introducing yourself?
Yes, so good afternoon, everyone. Thank you for joining us. And yes, thank you to Leukemia Care for inviting myself. And my name's Pauline Aiston, and I'm a health psychologist from University Hospital, Bristol and Weston. And so today's presentation is just a bit of an overview and maybe to start some conversations later on. And we're looking at helping patients cope with the psychological challenges of COVID-19. Okay. So just starting off looking at some COVID-19 restrictions. I'm sure you're all a bit too familiar with these, but I'm quite fascinated by the language used within these and some of the maybe slightly fear messages within it. And let's just have a look at them. So it says you're strongly advised to stay at home at all times and any face-to-face contact if you're clinically extremely vulnerable to protect yourself. Do not leave your house. Do not attend any gatherings, and this includes gatherings of friends and families in private spaces. Strictly avoid contact with someone who's displaying symptoms of coronavirus, and these symptoms are, and it goes into the symptoms, high temperature and or new and continuous cough. So the point within this is, I think we're all familiar with these restrictions, but sometimes the language used can be quite potent. And also what we're hearing in this is a reduction in one of the key coping strategies of social interaction and connecting with what matters, people that are closest to us, friends and family. Okay, next slide, please. So how do people cope with these restrictions? So perhaps, again, obvious, but worth noting is the need to sort of follow government and NHS guidance for self-isolating and shielding. And the rules around good hand hygiene and mask wearing, I think we're all familiar with that message. From a psychological point of view, I think it's really important to acknowledge your distress and to know that it's okay, because this is not a normal situation. And if you also have other illnesses, chronic illnesses, of course, this is an additional layer of uncertainty for you to adjust and adapt to. Try and look at doing things that matter to you. Identify those values, what can make you smile, what brings you a small amount of joy, and that can involve thinking quite creatively when those usual go-tos are not available and outside of your control. And there is that connecting with others, and again, perhaps all too familiar to us, this move to virtual interactions, but still, even if mood is low or it's easier not to bother, leaning into maybe the anxiety of technology and connecting with others virtually. To look after your body, to eat well, to do some level of movement. I avoid the word exercise, just some level of movement, because of course exercise is good for the body and the mind. Keeping a routine, structuring your day, looking after our minds. And that's an acknowledgement of, this is tough. This can be tough, and we will experience a whole range of emotions, and that's the human condition. And to get in contact with your clinical team if you need to. So I think that also requires a level of assertive communication, and also to limit or you might make the decision to limit your exposure to the news and the social media, which again sends these messages about COVID. Okay, thank you. So I didn't know whether to include this slide, but I think it's really important if anxiety is present and if the key message is about staying at home and isolating. Should you receive a hospital appointment, it can be quite anxiety provoking. So I think information and asking the place that perhaps you have to turn up to attend and saying, okay, what COVID-19 sort of precautionary measures are you taking? Might be helpful, and you're within your right to inquire and explore this. And ideally, this information should be readily available. So at university hospitals, Bristol and Weston, we're restricting the number of people on our hospital sites, and that's staff and visitors, and reducing non-urgent appointments. And where it is safe to do so, we're also offering virtual or telephone appointments. And that has been met with mixed response. Some people are very relieved that the appointments are remote. Some people have found the service more accessible. Other people can feel a bit unnerved in terms of feeling that they're not being monitored sufficiently or up to the standard they would like. So I suspect we might look into that and discuss that a bit later. In the hospital, we also have a designated COVID wards, and so some services have been relocated. And as you enter all the buildings, you'll find staff with hand sanitizer, PPE, and they'll make sure that you know where you're going, that you're going to the correct areas, and won't be put at risk of sort of the COVID-based wards. And there's that screening on arrival in the department where you can have questions answered and your temperature will be taken. Yeah, thank you. So risk mitigation. So ultimately, or how I see this and underpinning this, when we talk about fear of COVID-19 and managing existing health conditions, it's a really difficult balance. And which do you attend to, and which feels most sort of in your face and up close? And ultimately, this is that the familiar sort of anxiety curve, that anxiety is kind of a bell shape. And we know that with anxiety that it leads people to either face that fear or to avoid. And it's a strong emotion, and we can sort of unravel that a bit later on. But attending to what feels up close rather than in more distal factors. And what I mean by that is if you have leukemia or a blood cancer, and you're also receiving threatening, frightening messages about COVID-19, which one feels closer? And some of the messages from the media can actually make COVID-19 feel so vivid and so up close, perhaps more frightening than the fears that you may hold about your blood cancer. So it's very personal, but we know sort of from our cognitions and our cognitive biases, the way we think, that we tend automatically to attend to the things that are up close to us and feel really close and really near. And the media certainly at times can feed into that. COVID is the thing to attend to. So emotional factors also may influence and do influence our decisions of attending and not attending to a greater extent than the logical weighing up of pros and cons. And this is where you can look into maybe hospital provisions. You can wear the mask, wash your hands, and be sensible around living alongside COVID-19. But we are also driven by the emotional impact of what we see and what we hear. And we're not robots, and we don't sort of put it all into a mental computer and deduce always the most rational answer. So just to take account that emotion does influence our decisions quite heavily, those kind of gut feelings that we all experience. So you can make sure you have all the information you need to make informed decisions about your health. And I would suggest a raw honesty with yourself of whether the barriers to accessing help are predominantly driven by internal factors. And when I say internal factors, I mean thoughts and feelings, or external factors, which are sort of the things you can touch, the practical barriers, maybe the difficulty of transport, and maybe inquiring more about what are the processes and what is in place to keep me safe if I have to attend hospital or healthcare services. Consider obtaining accurate information from a reliable and trusted source. And we know that people tend to like guidance about the hospital setup, the processes that you might see and go through should you turn up at hospital, through someone they trust. So a named clinical nurse specialist, maybe a patient who you know well that you can trust, who has actually been through that experience of visiting that same hospital. So it's important that we feel and are confident in the source of the information that we're listening to. And the last point is to know for you what needs to be in place to help you feel safe and to have the confidence to communicate this need. So shielding as vaccines begin. So as I alluded to previously, underpinning this, I would suggest there's an anxiety curve. And with shielding, a lot of us have been shut away from kind of routine day-to-day life. And that fits with kind of the avoidance model of anxiety. And we've kind of been forced into that position of shutting ourselves away from daily living, day-to-day tasks, which means that when the time comes to either leave to get a vaccine or to start engaging in life as we once knew again, we may have lost a confidence and sense of competence around those day-to-day tasks. There's frustration with the lack of freedom at the moment, and there may be challenges at home. And we can feel very helpless, anxious, confused. Boredom is a huge stress factor, and sedentary activities. So if people are used to coping through meeting friends, attending gyms, gentle movements even, and those activities have dropped off, this is where stress levels become greater than our perceived coping abilities, and that's where stress presents. And home context is very different for every individual. So you might be managing children, homeschooling. You might actually have a lack of stimulation and feel very lonely and disconnected. You might be worn out of these virtual sort of screen and everything being on a screen, and that can be mentally fatiguing. There might be tensions and conflicts within the home or elsewhere. You might feel overrun by information on COVID, and you might have new approaches to the care that you're used to, perhaps entertaining community nurses visiting. And as I said before, if you've shielded for some time, it's likely that you may have lost a level of confidence and competence in re-engaging in the world. You may hold vaccine-specific concerns, and you may hold questions about the process of attending for the vaccine once invited. So really, this is starting to venture into sort of self-care now and how to cope. And one idea is self-compassion, because by becoming more compassionate, it helps us to rebalance and soothe those threat systems that are present in that anxiety curve. Judgments might show up of that being soft or I don't know, wimpy even, but self-compassion is really recognizing the human condition. And when stress is high, we have to work harder at looking after ourselves and to ask, how would my best friend, what would my best friend be saying to me right now? And how can I look after myself right now? And how do I want to be towards myself right now when I'm feeling stressed or anxious or scared or full of fear? And so there's further guidance of how to soften and manage that anxiety, to dampen down that peak of anxiety and settle what I call the primitive part of the brain, the reactive part. And I've put a website up there, which will be shared later with you, so you can refer to that site in your own time. As an aside, University Hospital, Bristol and Weston have also designed toolkits which anyone can access, and that too is a web page that will be shared later, and that's for general coping and guidance. Thank you. And so just to sort of round off, there's a few more sort of signposting things for cancer specific needs, emotional coping. There's Macmillan, there's One Cancer Voice. For general support, I'm finding that the Mind website, and this is just my personal view, but the Mind website for COVID-19 offers some really key information. There's also Every Mind Matters, and of course to know and to, you know, at times say hands up, I need a bit more support here, and to know that services such as the Samaritans and the text service Shout is also a really good one to utilise. And a common phrase, but a good one to end on, is it's okay not to be okay. Okay.
Perfect. Thank you, Pauline. I do like that phrase. I think everybody should have that in the back of their mind. And I think you've given a lot of examples there that people will be able to relate to, and hopefully people already feel less alone with their feelings as a result of that. So thank you for that. So next we'll come to our other speaker, Anne. Anne, could you introduce yourself and just add any comments you have beyond what Pauline's already said in terms of the topic of today's conversation?
Thanks very much. Good afternoon, everybody. It's lovely to connect to you all over the country. I'm in Stockport, Greater Manchester. I work as a counsellor and psychotherapist in the service at the Christie Hospital in Manchester, supporting people affected by all types of cancers. Before I did my current role, I was a hemato-oncology counsellor in London. So I think I've got two things that I'd like to sort of share, really, by way of introduction to what we're thinking about this afternoon in terms of shielding. I think the first thing I'd like to say is to acknowledge just how hard all of this is. And especially for you all who are having to manage additional challenges with the diagnosis. I think when lockdown began last March, certainly some of the people that I was supporting said, well, you know, lockdown, this is already very familiar to us. You know, to some extent, the challenges of living with uncertainty, the feeling that things are beyond your control, that feeling very vulnerable to the risk of infection, and the anxiety that goes with illness are part and parcel of living with the reality of a blood cancer diagnosis. You know, if you're having intensive chemo or going through a stem cell transplant, isolation and limiting who you see and where you go, that goes with the territory. But I think almost a year on, just about everybody is worn down, and the added burden of shielding, and you know, I agree with Pauline, the language to be described as clinically extremely vulnerable, in addition to that vulnerability that you can often experience, perhaps going through treatment, perhaps being neutropenic, you know, that is heavy duty. That's hard to manage and to live with every day. So I think it's important just to kind of acknowledge, yeah, this is really hard going, and it's normal to feel that you might be struggling sometimes. It's very hard to kind of maintain that, I don't know, that positive mindset that I think sometimes others put us under pressure to be maintaining when things are so challenging. So it's kind of like, yeah, being a bit compassionate with yourself and saying, yeah, actually, this is really hard going and I'm struggling, or I'm having a bad day, or it's a blip. So really that, yeah, this is hard going. And it's normal to feel that you're struggling in these abnormal times. My second reflection is to ask a question. What do you need to do to try and cope with what you're living through, and shielding in particular? And again, I was struck by the language, and I actually went to look up shield and to shield in the dictionary, because it's become this very scary thing that you have to do to protect yourself against the risk of COVID. I mean, that sense of staying at home can also feel like feeling very safe as well. So it's not all a negative. And I think for some who experience anxiety in general, just having permission and being told to stay at home can actually feel, yeah, that's great. I don't have to go out and face the things that make me feel anxious. But I think on the whole, with it, when it's so prolonged, it is difficult. And I also imagine that, you know, there might be some of you in the webinar this afternoon who have had your diagnosis during this time of a pandemic. So even more difficult to sort of try and reconcile with this enormous change to your life and in the context of a pandemic. But so when I looked up the word shield, you know, it's an object that gives us protection. And you know, the image that comes to my mind is the medieval knight in armor with you know, with that big shield to protect against these dangerous obstacles that are coming that way, or objects. And when we think of the verb to shield, again, it's something that we do, and we do it very actively to protect ourselves against the danger or the risk or the threat. So, you know, simply, you know, we shield our eyes from the sun. So I think I kind of wanted to play around more with the ideas of these things that we can actively do, not only to shield ourselves or yourselves against COVID, but to shield against kind of the low mood, to shield against the days when you feel that you're struggling. And many of the things, you know, that overlap with what Pauline's already been talking about. What do we need to do? So, I think, yeah, playful is the word that I want to use, because I think what I'm noticing is that we're really losing our sense of fun. And how can we engender some fun in this very serious conversation that we're having this afternoon? But I suppose for me, it was like, well, okay, how can I make those letters that form the word shield have something of a message that I'd like to convey this afternoon? Again, sort of supporting what Pauline's already been describing. So S for shield, I thought, well, that S could be structure and predictability. When we've got a bit of structure to our day and routine, it becomes a bit more predictable when we're living with lots of uncertainty. So how can I engender some predictability into my day? What might be my routine? The other S for shield, I thought senses, kind of when we're experiencing things through our senses, we're really living in the present moment. You know, I'm working from home in my little study. I've got hyacinth plant, which is now in full bloom, and the scent, another S, you know, it just takes me away from the heady stuff. So things that we can do to be in our senses. Controlling what we can control. H, help. Pauline's talked about help. Asking for help. Actually, that takes strength sometimes to, first of all, be aware that we're struggling and we might need some help, and then to ask for that help, however that might look. H is also for hope, and it's very hard to kind of plan and think ahead at the moment, but being able to make sort of plans even for the rest of the day or tomorrow, to have something hopeful to look forward to, I think can make a difference to our outlook. H is also for holiday. Wouldn't that be lovely to be able to plan towards? But that's also difficult, isn't it, when you're living with a blood cancer diagnosis, because of the uncertainty that comes. So again, it's a familiar uncertainty to live with. SHI, I for interaction and connection, that, you know, we're social beings, that human contact that you're missing so much. And yeah, and we are getting a bit Zoom fatigued, I think. But it's, you know, we still, I think, feel better for having connected with someone, whether that be by text or online, by Zoom or the equivalent, or, you know, I sat and wrote a card and, you know, put a card in the post the other day. I could easily have emailed and had that instant connection, but it just felt, I enjoyed that, putting, you know, writing a card, putting it in the post, walking to the post box, going outside, getting some fresh air. Which brings me to E. So it does have to be E for exercise, but exercise with the broadest meaning, any kind of physical activity, any kind of movement, whether that be, I don't know, putting on some music and dancing around the kitchen for a bit, as using a different sense, to walking to the post box. I know shielding means that you're not supposed to leave the house. I hope some of you are being naughty and leaving the house, but in a safe way. So, you know, I've got people I'm supporting, and they say, well, I'm going for a walk really early in the morning, even before the sun comes up, because I know that the road is empty, but they're getting some fresh air and some movement around. Or, you know, if you've got a garden, going outside, even putting your head out of the window to get some fresh air. It's just that sense of being in our bodies. And some of you will be struggling with fatigue as well. So that's a challenge. But we know a little bit of physical activity and movement in manageable chunks is going to help the fatigue as well as mood. L for laughter and enjoyment, back to that sense of fun. I'm not a great one for watching comedy programs on TV, but I found myself really searching for and watching some really, I don't know, old-fashioned sitcom. You know, The Good Life was on the other night. And so anything that's going to bring you into the present moment. Laughter, we get these lovely chemicals in the brain that help our sense of well-being. But really anything that we enjoy. And again, we're faced with so many obstacles at the moment. You can't do the things that you might have enjoyed, and having to kind of find alternative ways of doing that. But, you know, spring is coming, plant a bulb in a pot, enjoy watching it develop. Whatever gives you enjoyment, but it's kind of reconnecting as everyone is flagging. It's been a long, hard time, but it's trying to just remind yourself, actually, what am I missing? And is there a way that I can shift that around and find a way to similarly enjoy that? And D, the last letter of my word shield for today, you might work it for yourselves. I finished it with dig deep. In two aspects. Spring is coming. It's a lovely day today where I am, and I went out for a walk at lunchtime, and I have to really make myself get up from the computer. For those of you who are working from home, you know, that's important to remember. And the crocuses were out, and so, you know, so I'm thinking, yeah, digging. I'm lucky I've got a little veggie patch that I can dig. Again, take precautions, but you know how to look after yourselves in terms of risk and safety. But also we have to dig deep internally. We have to dig deep to all our emotional and psychological resources. So, you know, you'll have faced many obstacles and challenges in life, because that's the nature of our life as human beings, and we are resilient beings. So what helped you cope before? What can help you cope now? Is there a way to adapt that to the restrictions that we're faced with? So there's something about flipping that shielding around from being a scary, scary thing that you have to do to, actually, I'm going to design my own shield and put that on and armor myself against the challenges that I might be feeling. Okay.
Great, thank you for that, Anne. That was really, really great in terms of plenty of coping strategies and advice there for people listening. I hope they found that useful. What you said about the language of shielding, I hadn't really thought about, which if someone had said shielding back in January last year, I probably wouldn't have had a clue what they were on about. So it's interesting how language does evolve in times like these. And again, what you said about fun really, really resonated as well. I think we're all missing a little bit of that lately. So before we dive into some questions for everybody, we want to come to our patient speakers today. First is my colleague, Nick York. Nick, do you want to add your thoughts to what's already been said for me?
Yeah, hi everybody. Thank you, Anne, and thank you, Pauline. Before I came to chat with everybody today, I had written down a load of things and challenges, and I might run through a few of those because Anne and Pauline have very nicely brought them all up with coping strategies. And I think the first thing that I'm going to start with this is that I am obviously an individual, and my experiences are very relative to myself. And my circumstances is I am alone at home, and I have a dog. And I was diagnosed with CLL, and many of us in the audience and with us here today are CLL patients. And you know, one of the first things you learn with CLL, it's a chronic condition. It's not a sprint, it's a bit of a marathon. And the first thing you have to overcome as you're coming through diagnosis is learning that you can live with it, but it's how to learn to live well with the disease and learn to how to cope with all of these anomalies that are suddenly thrown at you. And, you know, one of those is living with an immune compromised challenge. And, you know, as Pauline brought up earlier on, you know, you do gain some experience of avoiding infection and you're already vigilant. But I suppose that's leading me into the thing that I don't want to talk in too much detail, but this is all a bit of a marathon at the moment. And I've kind of, because I'm obviously advocating for people and I've got a fair amount of experience listening to others, I'm trying to reflect on it for myself, because that's actually how I've been dealing with this. Listening to Pauline and Anne, you've been like medicine. Oh, you were actually lulling me away, you're calming me away to sleep whilst we were chatting then. It's like, oh my God, I've got to talk to everybody. What am I going to say? So from that point, I've kind of split things into two halves really, because I'm not saying it was exciting or interesting, but the first year of shielding, there were lots of barriers to overcome. And, you know, I living on my own, sharing my own journey, and I have a garden and the weather was wonderful last year. And yeah, we had some challenges to overcome. You know, how the hell do we get food in the beginning when everybody's panicked but bought everything that was available in the supermarkets and they hadn't sorted out deliveries and, you know, totally. And then, you know, those early feelings of isolation and being forgotten about purely because we were living in a lot of fear of the unknown, you know, and the initial elements, you're so used to contact with your clinical community. So, you know, you're used to the fact that you've had to have regular blood tests, you've had to have certain types of appointment, and how do you get your meds delivered? You know, we routinely make sure that we're not late with our medications and things of that nature. But we worked our way through all of that, and the summer helped. And, you know, for me, I just got a big picture of sunshine, you know, summer. It's like, well, in the back of my mind, I know that's coming again, you know, that's going to help. And I'm a fortunate individual, and I feel a little bit guilty sometimes as well, knowing how the rest of the population are also struggling, families are struggling. But it isn't easy, and it wasn't then. But, you know, so summer for me was great, got my head around it all, dealt with everything. I've got a dog, so I'm not totally alone. I live near the hills, can get plenty of exercise, threw myself into, you know, I think it was Anne, you talked about the good life. My house was the good life. I mean, look at me at the moment, I'm COVID, you know. And learning to connect virtually, was all new for us all. But we did settle into a bit of a new normal, and I don't know why, but I'm kind of now feeling as a person a little bit of change. I've almost drawn a line through it at Christmas, you know, because I'm looking at this at the moment thinking, you know, I think Anne or Pauline brought it up. We've been battered by the media. We've been battered by the media, and it's been unfair. And I think one of the hardest things as well is change. You get into a routine. You learn how to live. I live with a, CLL. It's pretty boring, really. CLL. It's like living with periods of total and utter boredom for a long period of time, and then maybe flashes of panic every now and then when you have to deal with something. And maybe as shielders, we got into a routine of safety. And so for me, the biggest trials of last year shielding was every time they couldn't make their mind up whether shielding was stopping, starting, what's going to happen next, how do I go out and do this, does everybody else going to be respectful of the safety needs we have. So shielding, you kind of know where you are. So I'm kind of reflecting that at the moment, that now maybe there are different uncertainties. It's like, how are we going to get back to normal again? And now beginning to really struggle, and I've got to be honest with that, struggle to stay positive all the time. And it's hard for me sometimes because I'm an advocate. I advocate for everybody and, have to appear positive. But, let's be honest, it's a pile of poo, a lot of this, quite often. So, I've got other issues like we all have, it's been a long time where, who's been able to go to the dentist? Who's been able to get their hair cut, I'm looking at my little list here because there's not a lot left on it because, the optician, I know my right eye's failed whilst during shielding, and I haven't been able to get my glasses sorted out because I can't really sit in front of an optician and let him breathe in my face at the moment. And then you've got, we maybe have got, it's not so much access, we've got cumulative worries perhaps. I don't know how other people feel, but trying to stay healthy and disciplined to remain healthy when you can't maintain a lot of your general health is a real challenge. So in the back of your mind, you're carrying a fear you don't want to get unwell at the moment, so close to getting the vaccine. It's also that other thing as well, is I'm getting my jab on Saturday. I'm sure loads of people here have had their jab. And it's not knowing how much of a response we're going to get as a CLL patient, for example, with a compromised immunity. Every 2 weeks I receive my immunoglobulins. So I'm not too hopeful of what the vaccine will do for me. It's what it will do for the rest of the population, maybe to provide safety. But then again, before I sat here, I kind of grew across, positives for last year, negatives for last year, positives for this year, positives, negatives. And, there's a lot of positives at the moment. I seem to have got it sussed. I can get everything delivered to the house within 6 hours. I'm connected to everything digitally. My mobile phone works, all of my apps work. They're actually ordered on my phone so that everything connects. I mean, I've even got a smart telly now. I didn't realize I was living in the dark ages, So, feeling safe, winter, maybe that's a bit of winter's on its way out. But then there were other cumulative issues, and I'm bringing them up because I'm sure other people are feeling them. I was chatting earlier and I realized I was drinking with a mug and it's got my daughter's face on it. She sent me this at Christmas because she said, if I stick it on a mug, you're not going to forget me because we haven't seen each other for so long. And, my girlfriend doesn't live in the same house as me and she works in the front line. So we've had no physical connection for a year. And you're used to sort of spending half of your week beside each other. These things are beginning now to wear. So there's that element of fatigue and it's difficult for them as well. I'm mindful of how difficult it is for the family and it is for friends. So it's hard to also keep them positive. And I do struggle with a lot of that myself. So I'm noticing I'm talking about, so I'm being honest, I'm coming into an area as an individual where I'm sort of struggling because of the uncertainties of how will we come out of this in the population that some of us might not respond too well for vaccines. Are we going to be looking at the really long-term situation where we're going to have to, and how do we navigate through this next period of uncertainty and change? And I'm also now struggling, I don't know, maybe the psych team who are with us, that after so long now, the summer, it was really easy to remain disciplined, have a routine. I used to work myself to the bone every day with the garden and my walks. And I must have been getting up in the morning, enjoying the sunshine and falling asleep. And life was really good. But I don't know if others feel it. It's hard to remain disciplined and not slip into bad habits and maintain the good habits. And these seem to be the things that I feel. So sleep, sleep for me is a real indicator when things are becoming challenging. And I'm noticing at the moment, I'm not sleeping as well as I did. And I had a period of that during early. So I'm picking up some of these challenges at the moment. So for me, I think at the moment, it's a bit of a pivotal moment for us all. We've been sheltering for a long time. We're still needing to remain vigilant. We're going to likely have to remain vigilant for a long time. And it's how do we get ourselves in a mindset going forward so that we can properly cope with that. So that's the way I'd like to set the scene. But I think from a positive, there are a lot of positives there. Vaccinations are working in the rest of the population. The numbers of vaccines coming available. We are going to be able to get out of this, and we've got spring, the garden. So for me, I'm really excited because I can start planting my garden next month. But I've got a lot of trepidation there, and I'm one individual that's probably struggling. Maybe I think too much about it, but sorry if it sounds negative with my introduction, but it was just a way of setting the scene for the discussions, because I've got plenty of ideas of being positive. I mean, on that note, I better shut up, Sam, and hand it over to you. Yeah.
Thanks, Nick. That was really interesting, and I think you're right about looking at it from positives and negatives, and maybe we'll come back to that in a moment. Sam, did you want to introduce yourself and set the scene from your perspective for us?
Okay, so I'm Sam, and I was diagnosed with acute myeloid leukemia in April 2016, and I had a stem cell transplant in August 2016. I've been in remission for nearly 4.5 years now, and it's quite a difficult journey to get to this point, to be honest. And COVID could not have come at a worse time for me personally. I decided last year that I was going to reclaim my life, and I was going to get back out into the working world and, really just go gung-ho with it. I'd done my time, and that's what I decided to do. And I was preparing, going to interviews and things like that, decided what I wanted to do with my life. And then COVID came along, and it just all got blown to pieces, because I want to work in hospitals. I want to be a cancer support worker. And as it stands, that's not something that I'm going to be doing for quite a while now. So I'm having to really think about what else I can do. And it took me a really long time to get to the point where I knew what I wanted to do. So that was very, very difficult for me just off the bat straight away. I knew that I would probably have to shield, but it took quite a long time for my letter to arrive. And I just want to echo what the professionals have said about the language used, because it's very difficult to read something like that and not be scared. You immediately feel like a patient again, even if you feel like you've moved on from that. I decided at that point that I only wanted to have 1 blood test a year instead of 4. And I'm back to 4. I'm having 4 because they want to keep on top of things. I don't have a choice. It's something that I've got to do now. But that language really set me back, because in the second letter, it spoke about packing an emergency bag and putting it by your front door. Now, anyone who has had an acute leukemia and has been on ward leave between chemos will know that one of the things that they have to do is pack an emergency bag for those potential night visits to A&E. So that was very hard to read, because I just went straight back into that mindset again, that I was a patient, and this was a really awful thing, and it was really difficult to get my head round. I'm used to risk managing. I've been doing it ever since I was diagnosed. I risk manage every single situation that I am ever in. I look at the amount of people, I check the cleanliness of places I go to, and I've always done that, but I'm worse now. And I thought I'd gotten over it. I thought that I was managing it perfectly well, and COVID just sent me right back to the beginning again. I got horrendous PTSD, which anyone out there who has had that will know that it's awful when you're being reminded of your trauma, and there's constant triggers. Especially in the first lockdown, when I was seeing people with surgical masks on, and that straight away sends you back to the time when nurses would come into your room or doctors would come into your room and they would be administering your treatment. It's a very difficult thing to get round. I've also found the isolation part in particular very difficult. And again, as an acute leukemia patient, I spent long periods of time in an isolation room. And the only people that I would see really were my health professionals and the occasional visitor. So to then go back into isolation as a person who lives on their own, who doesn't have a garden, who doesn't have pets, it's really, really challenging. I also really miss my family. I have grandchildren and they are only 3, 2 and 19 months. And my 19-month-old asks for cuddles through the phone. Whenever we FaceTime each other, she cuddles a phone and she just says, "Cuddles, Nana," and she gives me a cuddle. And it's heartbreaking. And I know that lots of people will be in the exact same position where they're missing their grandchildren growing. It's really, really difficult. And I can echo the lacking in motivation, the lack of routine, sleep disturbances. I've had horrific sleep disturbances. I wake many times in the night. I take hours to go to sleep at night. I'm worrying about finding a job after all of this is over, because how easy is that going to be? It's not. The fear is constant, and it's something that you live with as a leukemia patient or a blood cancer patient in general. It's something that you live with, but it's constant now because we have something else to think about as well as our diagnosis and the implications of that. Not being able to see our consultants, very difficult, because I don't know if anyone else's experiences, but when I've spoken to them on the phone, it's like they're in an echo chamber and you really can't hear them properly. It's adjusting to yet another new normal and spending birthdays in lockdown, not being able to celebrate families' birthdays. I wasn't able to celebrate my rebirthday. Too much time in my own head, very difficult. And the weather doesn't help, although most of us won't be socializing because it's raining. So we wouldn't be outside anyway. But if I was to say of the pros, there are loads of pros. When I really thought about it, there's actually quite a lot of pros. I schedule FaceTimes in every single day and I have Happy Post. So whenever the postman comes, I get really excited. And how many people can say that? They don't really get excited when the postman comes, but I get really excited because I get pictures from my granddaughters and cards from my friends and just little presents that I wasn't expecting. And it's just absolutely lovely. A friend of mine in the first lockdown brought me Sunday lunch every Sunday and just left it on my doorstep, which was just fantastic. I've been making lists and getting things done that I haven't been doing. I've been procrastinating over. I'm creative and resourceful ways to make memories with people. So I read to my granddaughters of an evening while they're in the bath, and I read them their bedtime story. My sister and I read a chapter each to each other via FaceTime. We're reading the same book and we read a chapter each to each other. And I taught my sister to make coleslaw over Zoom, and we shared playlists and talked about the related memories of the songs we played. I've been doing quizzes with my children and realizing who is really clever. And I've learned how to use Zoom and Teams, and I am a technophobe. I am terrible. I don't like it, but I'm doing it, and it's, I'm learning something new. I've developed really great relationships with my neighbours, which is lovely. In the summer we sat outside, socially distanced, and chatted to each other, and it's absolutely lovely. And my neighbour upstairs does all my shopping for me. And I've discovered new walks in my local area, and I have coping mechanisms to draw on from my previous experiences. So I feel very lucky that I have those, that I can employ those, because I know that a lot of people don't have that. So I reduce my social media when I'm being overwhelmed. I find joy in the small things. We've talked about this. I've made lists. I allow the emotions to come and I feel them. I don't dismiss them. I'm not a crier by nature, but I've cried a lot since last March. And I feel like it's a really important form of self-care. And talking about self-care, I take time out every single day to do something for myself, to make myself feel good. And I mean, that can be switching the news off, for example, or it can be putting a face mask on. I read a lot, mostly to disappear into another world, but also for relaxation. I talk a lot to my family and friends every day. It is really hard to be positive all the time, but I do try to be. I do puzzle books to keep my brain active, and I acknowledge that I cannot control this situation, but I can respond to it in a way that I feel is appropriate. That's my control. And I'm increasing my experience so that I have more to offer when I'm applying for jobs. So I've volunteered to be a head facilitator for a charity that supports cancer patients, and I'm looking into cancer support courses. It's, you know, I'm trying to keep going. All of our feelings and concerns are valid. We are all allowed to feel overwhelmed. We are all allowed to feel depressed and anxious. We are all allowed to have mood swings. The unhelpful language, they really need to sort that out, because I think that that's contributing to all of these things that we're going through. We're all allowed to be fearful and scared. We're all allowed to feel like it's an uncertain landscape. There's nothing remotely normal about our new normal. We've been denied the usual rhythms of life for a prolonged amount of time, and we have no end date. It's okay to feel all of these things. And if you're feeling any of these things, it is valid. And please don't ever think that you have to not talk about it. Talk about it. Be kind to yourself. You're doing the best you can in the current circumstances, and it's okay to have a bad day. Just be hopeful that tomorrow will be better. We've come this far. We have numerous vaccines, and at the moment, our country is rolling out the vaccines quicker than the rest of the world, and we're only a tiny little island. It's starting to have an impact, and it's a step in the right direction. And I understand that rebuilding our lives will be difficult, but hopefully with time will come more information and more guidance to help us integrate back into society. And to end this, I am wearing a jumper today specifically for this reason. It says, I haven't come this far to only come this far. We've got this. We've got just a bit longer to go.
Thank you, Sam. I'm going to sign you up to a motivational speaking course. That was fantastic. That was really good. Thank you.
No problem.
Okay, so we've covered so much so far. Some fantastic coping strategies and just general positivity, which is something that's really important when we're talking about a difficult topic. So let's dive into some questions. I just wanted to remind people how to ask questions. If you're on Facebook, just pop something in the comment box and we will pick it up. Thank you to everyone who's commented so far in the chat. You'll have to use the chat box if you're on Zoom. We won't be unmuting anyone or allowing you to share videos. So yeah, drop us a message if you do have a specific question. I'll start with a few things I've picked up as we've gone along then. Something that Sam said there that I wanted to pick up on with Pauline. How do you deal with feelings of sort of lost time, if you like? So COVID's been going on for nearly a year now, and Sam was talking about how she was thinking about getting a job and those sorts of things. What would you advise people who really feel like they've lost nearly a year of their time?
Well, I suppose I would look at the expectations we put on ourselves, because I think there's almost, not for all, but for some, an expectation of we should get this by now. We should know what we're doing by now. And change is always stressful. But some of what I'm hearing today is we can reflect on that and think, well, it was stressful at the time, but actually I've learned some things and that's been good. But it's, in my head, I'm kind of comparing it to the parallels I see in health, that with some treatments, you go into a mindset of, well, I'll just go in, have it treated, get out the other end, and that's fine. But the parallels with leukemia, blood cancers, and the chronic nature of COVID are so similar, aren't they? And I think everybody is kind of thinking, where is the light at the end of the tunnel? How do we hold on to that hope? And with the sense of lost time, or having things we want to aim for, I talk a lot in terms of values. So with the example, Sam, I hope you don't mind using the sort of idea of the cancer support worker, a great ambition, a clear idea of that's what I'm aiming for, but there's a real barrier to this. It is then thinking about, rather than the can and the can't, but the how, and rather than that being an immediate close-up goal, to think, okay, that's still the path I'm traveling towards, and what can I, and this is what Sam is explaining, I think, that you've been doing, what can I skill up on now, and so I still feel like I'm moving in that direction of travel. And I think just generally when we look at what has been lost, so we might not be able to, I don't know, meet up and, dare I say it, play football. I don't play football, but we might not be able to engage in our usual social activities. Rather than stick to the, I can't do that, it's been stolen from me, it's been lost from me, it's worth looking at that activity and think, okay, I can't go and play football on a Saturday, but actually, maybe it's not just about the football. Maybe it's about having something structured in at a certain time on a set day. Maybe it's about having something to look forward. Maybe it's about some level of movement. Maybe it's about the fresh air, the daylight, the social interaction. So when you have hopes or a sense of things that have lost, break it down and think, what components within that can I grab back, and I can still work towards things. And to turn this comment on its head, if we are feeling at a bit of a low ebb and we are thinking time is passing us by, it can be a motivation to think, next week, do I want to be looking back and regretting the time that I've been wrapped up in angst and low mood? Or do I want to be able to look back and be proud of what I've done despite those thoughts and those feelings, and to know that your behavior, what you do, overrules thoughts and feelings every time. So if you feel low and you feel like not doing anything, your power is you don't have to listen to your thoughts. You don't have to buy into those feelings. Easier said than done, but overrule it by a value-informed behavior.
Great. So I think, Sam, that reflects nicely what you were saying about
It does.
developing yourself. And I know you've been reading loads of books. I've seen your piles and piles of books throughout lockdown, so you've been keeping yourself busy. Another question that has come up is someone commented that they were struggling now, and this sort of came out from what Nick was saying, about struggling now more than they were earlier in the pandemic, say March. They sort of just got on with it in March because that's what everybody had to do, and now the long haul is a bit more difficult. I wonder, Anne, if you could comment on whether that's rational to feel that way, and how you sort of rationalize that in your head and cope with those feelings of in it for the long haul.
Yes, I when we think back to last March, I can remember thinking, oh, well, hopefully by September I'll be able to go on that holiday. We had no idea about the time scale that we'd be facing. And I think, Nick, you were pointing out that it's been so hard in terms of shielding with the, yes, you have to shield, now you don't have to shield, or sort of shield, or the kind of like these, sometimes the very vague messages that come. So that's been a kind of a roller coaster ride, which I think in itself kind of is very wearing. I think there's something about that sort of that time scale. We talk, back to language again, about the light at the end of the tunnel, and holding on to that sense of actually a better time will come. And I think what's made this so hard is that nobody's been able to have a sense of what that better time might be, or when it might be, and I think that's felt very uncontaining. So so the decisions that are being made kind of nationally are changing a lot of the time because of perhaps new information, or for whatever reasons. And I think that becomes, we then have to fall back to our own devices to try and get that sense of, well, here's the future point. And I think that's, Nick, that's what you were really describing, is is how is it going to look? And I was sort of like very aware as you were talking that nobody really knows how it's going to look. You know, we're talking about the new normal. You know, that finding that the new normal is, you know, in the world of cancer, that terminology has been around for a long time, because it's about actually things aren't going to be the same. And so, yeah, so it's exhausting, this constant sort of trying to get a sense of, you know, a way forward. I think that the way to approach it is to kind of like reduce the timescales, if we like, almost like in smaller chunks, and break it up that way, rather than wondering about this sort of, you know, the light at the end of the tunnel. Yes, there are suggestions and there's hope now with the vaccine that perhaps it's uncertain for, you know, for some of you how effective the vaccine will be, but certainly in terms of the whole population, it will make it safer for everyone, but particularly people more at risk. So so I think there are the beginnings now. But I think, you know, if I think, will I get on that holiday in September? That feels too far away, actually, to be thinking. So I think it's, you know, bringing it back and reducing the timescales for now, and therefore the focus of, you know, becomes around, well, the coming days, the coming weeks, perhaps up to the coming month, but trying to break it down a bit like, you know, if you've been through very intensive treatment, Sam's had a stem cell transplant, it's, you know, it's very much about, you have to break that recovery time down into manageable chunks. And okay, this is what I'm looking at this week, and I might compare that to last week, rather than, you know, in 6 months' time, I'm going to be able to do this, because you're forced to kind of go at that different pace. So I think it's something about the pace that you give yourself, the kind of the time scale in terms of sort of planning and focus, breaking it down into manageable chunks, and not having too much, I suppose, something around expectations and the shoulds. You know, we're very good at putting shoulds on our shoulders, which are really, you know, weigh us down, you know. So I should be able to do this in 2 months. Well, who, you know, that's perhaps not a very helpful way of thinking about it.
Great, thank you, Anne. And sort of picking up on a similar topic, then, is a few questions around uncertainty about what's going to happen next. And I wanted to come to our patient members at this point. Sam, I wondered if you could comment on how you cope with uncertainty since you were diagnosed with a blood cancer, but particularly recently with shielding on top.
Well, I'm just going to echo what Anne said. I learned very early on to take things sometimes I was taking it 10 minutes by 10 minutes. But I've learned just to take it day by day. It's very, very difficult to not know what's going to happen, but that is the nature of life. We don't know from one day to the next what's going to happen anyway, in any given situation. So it's being open-minded that, you know, some days will be really good and you'll get through the day and think, oh, I haven't seen anything. I purposely only watch the news once, and that's, you know, I don't watch it all day long. I know some of my friends do. But to cope with that uncertainty, I make sure that my exposure to the news is very limited, because it's difficult. You get drenched with this information, and it's very, very hard. But just to take it day by day and to sit with whichever emotion you're feeling. Don't think that you can't express how you feel. It's okay to express how you feel. It's okay if you say, I'm really not sure about this. It's okay. There is no definitive way to get through this.
Nick, anything you wanted to add to Sam's comment?
Yeah, I can relate to everything there. For me, it's a little bit like diagnosis. I've gone through the lumpy porridge of FCR and chemo, and I'm on a continuous therapy. But I remember diagnosis was almost like one of the key parts of learning to live with your diagnosis was taking ownership of your diagnosis and your disease, so that you can be, proactive. It's a little bit like that with this. For me, from a point of view, concentrate on what you can do, not what you can't. Yeah, that's my motto in that. And so therefore, and Pauline brought it up about not lowering your expectations, but just setting your expectations a little bit differently. So you're doing things differently, but you can compartmentalize that into terms of things that you are actually achieving something, and it's different shape, but you can enjoy it so that you're actually enjoying something rather than just surviving. So you're living. So as an exponent of somebody that's always trying to look to help people to live well with their cancer diagnosis and their challenges, that's the way I try to approach it, with the uncertainty, so that it's almost I've come to accept that there's going to be this variability, it's going to change, and therefore I suppose what I was coming to with my conversation earlier is that I've had to face a personal decision coming to this part of the year, that my life expectations, I think, have changed slightly. I think after a year in this, I'm no longer, you can't lean back and rest on the laurels of how you thought things were going to be. I mean, I'll be honest, at diagnosis 12 years ago, I didn't think I was going to be here. So, it's great. I can live well with that. So it just then follows on. So I've kind of had to readdress that and think, well, maybe life is going to be a bit different, but it doesn't mean it's going to be worse. And I'm, agreeing what everybody said from a planning point of view. I'm a gardener, so I can compartmentalize that. I've already got it mapped out, what I've got to do. And I came from a bit of a building background as well, and that was always seasonally orientated, and you had to sequence anything. So I suppose that's what I'm trying to do at the moment, is build in new routine and a new shape that fits this sort of, the square peg into the round hole that we're trying to live in at the moment. I don't know if that makes sense.
It does. Yes, definitely. Thank you, Nick. Just thinking a lot of the coping strategies we've spoken about today, various speakers have been trying to encourage us to continue to connect with others. But one of the questions we had beforehand was somebody finding it hard to motivate themselves to connect with people because they're so far away, because you're not seeing them in person. Nick, you're nodding, so I'll come to you first. Is that something you can relate to?
Yeah, I'm actually enjoying being on my own to some degree. There are some positives to it.
So your girlfriend's not listening.
You don't really be saying this. It's like all of a sudden, if I'm interrupted, it's like, who's interrupted me? So yeah, struggling to connect on two fronts. I'm not sure I'm I'm not reacting well to people when I'm out walking the dog and they're not necessarily complying, and I'm living in my bubble in my mind and they're living in theirs. So I guess I'm fortunate because I have a lot of digital connection like we have now. So I'm interacting. So I'm being human. I haven't lost the human touch, I hope. Yeah. But I haven't been in a shop for as long as I can remember, and I am nervous about going to get. I've got to be honest. I'm like any other patient. I'm not sure what response I'm going to get from my vaccination, but I'm going to the GP surgery for my jab on Saturday. And, when they tell me over the phone, don't bring your car, walk if you can, it tells you how big the crowd's going to be. And so there is, I am a bit of an issue of reintegrating. And I don't know if I should be feeling guilty about it, but I'm actually quite settled at the moment in that role. And I think Anne touched on that earlier. And, am I burying that? I don't know. I'm living. I'm not just surviving at the moment. But I feel that I don't like that feeling of fear of putting myself across the threshold when there's those uncertainties. So I'm not a great candidate. I do practice what I preach, but I am very vigilant in how I protect myself at the moment.
And did you want to comment on that question in terms of if there is someone who is struggling to motivate themselves to make that connection with others at the moment? How is that normal, and how would they deal with that?
I think I can relate to that, actually.
Yes.
We can think of ourselves as introverts and extroverts, and the introverts are we recharge our batteries. We enjoy that time on our own. It takes our energy to have lots of interaction, and whereas traditionally the thinking would be that extroverts get their energy from being with others, and the whole experience of lockdown has taught all the introverts that actually we do miss that social interaction and that connection. And I think perhaps the extroverts are also discovering that, yeah, actually it's quite nice having this sort of time to chill and do my own thing. And so again, it's that, where's the nuance? Where's the, actually that's yeah, I'm finding something in this situation, and I'm learning something about myself in this situation. Now that motivating to connect, I guess it depends on who you want to connect to, how what's the easiest way. I think when we struggle with motivation, rather than it being setting ourselves again a sort of a less achievable goal, it's actually what's my easy win here. So maybe think of someone that you want to connect to, and think of the easiest way possible to connect to them. So whether that be, I don't know, picking up the phone and just texting someone and having a text conversation, or perhaps just reconnecting. I don't know, I seem to be a bit obsessed with putting cards in the post and postcards in the post. Do you remember when we used to have postcards and send postcards to each other? And I think I'm very aware that many of you are kind of like stuck indoors, and even to get to the post box is would be a bigger, a potentially risk-stroke adventure. Again, it's kind of like, where's the nuance? Am I going to see this as an adventure to go to the end of the road and post that card safely, or does it feel like, oh no, I'm too frightened to go out? It's it's just kind of like, so it's that thinking about, well, what would be the gains if I send the text to that person I've been thinking of, just to say, how are you doing? How would I feel having made that connection, rather than that energy that sort of it's energy sapping, isn't it, to think, oh, I can't be bothered. It's just too much effort now to pick up the phone, and then you sort of sit there feeling it sort of weighs on you, and you feel a bit guilty. Oh, I should. Back to the shoulds, which sap our energy. So it's kind of, right, what's my easiest win here? Who can I connect with? How am I going to do it? When am I going to do it? Has this conversation motivated me enough to say, right, at the end of this webinar, or even leave the webinar now, but go and make connection with that person? And once you've kind of overcome that first hurdle, it follows from then. Then weigh it up, experiment with yourself. Actually, how do I feel now that I've sent that text message, for example? And then let it build some momentum from there. But start small. But once the idea is floating around in your head, act on it, because it will take much less energy to do that than it will to sit there and think, oh, I can't face it. And again, it's not to say that this isn't wearing us down, all the virtual communication, but at the same time, it is our best way of connecting. And I loved what you were saying, Sam, about reading to your grandchildren. Fantastic. Yeah, and that reading chapters to each other. Really, really, I don't know, maybe Leukemia Care can produce one of your fantastic information booklets about ways to manage during lockdown with all these creative ideas, because you know, that would be something.
Definitely, thank you. I'll make a mental note of that. And if anybody does want to send post and is worried about going out to a post box,
Yes.
you can get your post collected now for a small extra fee. So if you did want to take up the postcard, there's a little tip from me, my contribution to this webinar. I'm conscious we are running out of time swiftly. So much we could discuss, but a couple of things I've picked out from questions we've had. Pauline, I just wondered if you could comment on risk management. It's something you brought up in your original slideshow. We get many questions from patients about specific risks, like families still going to work and potentially bringing the virus home, children going to school, or working in particular occupations where you have to continue going to work and you weren't able to shield. Do you have any advice for how people sort of rationalise and cope with those very specific risks?
I think it's a tricky one. I think this is about perceived risk. I think it's about communication, and it's following the guidance and being, I guess, honest with yourself, but also sensitive to what you might deem as a sort of an okay behaviour that others might really feel very threatened by. But it's tricky because people form opinions, have judgments in terms of, oh, they're being overprotective, or they're not taking enough precautions. So I think it's more discussion and checking out where each other are in terms of what makes yourself feel safe, and having those that as confidence and assertive communication to guide others if they're part of your environment. But it's also a sensitivity and trying not to judge others that you might think, oh, they're being a bit over the top. But there is that constant management of risk and never that guarantee. And so, yeah, I think that's all I can really say about it. To be sensitive, be confident in what would help you feel safe, be prepared to share that, and assertive, and know it's your right to share that, but also check out with others, what's this like for you and how are you seeing this, and sharing where everyone is at. And, you know, as I said in the presentation, it's worth contacting people and saying, what do you have in place? You say you're COVID safe, or you're, you know, can you tell me what that looks like in more detail, and seek that reassurance if you need to. Yeah.
Perfect. Thank you. Another area we did touch on very, very quickly earlier is people who've been diagnosed during the pandemic, and that must have been a particularly difficult time for them. I wondered whether first, Nick, you could comment, and then maybe I'll move on to one of our professional speakers. But if you thinking back to when you were first diagnosed, how would you have felt if there was extra pressure? And you're on mute, just so you know.
You know what? A year into shielding, do it every time. Yeah, I suppose I'll have to be a little bit myopic from the point of view of look at my own diagnosis as a CLL patient. And it was different from, I think back then, going 10 to 12 years ago, it wasn't pointed out early on that I had immune challenges or likely to have immune challenges. And it was only when I reached out to a charity first, there was the CLL Support Association, and the policy was, right, one bucket fits all diagnosis. We've got a one bucket fits all strategy, which is you need to follow certain hygiene and safety strategies. And it was that stage then that I probably, like many patients, overreacted to that, you know, at diagnosis when I wasn't probably at risk. I was hearing people sneeze 2 carriages down on a train, or, you know, I was a little bit obsessive with that. And that made living with the diagnosis and understanding what that meant to me with a lot of other things, you know, when will the disease progress? You know, how can I take this all on board to live a more normal life and start living well again? Now, outside of COVID, that was hard enough. So yeah, I'm thinking of CLL patients as well, coming into that environment in COVID, with this all being wrapped. I think I might have even raised the question. I think from that point of view is connect with other patients would be my advice. Yeah, this is an area where probably the eureka moment for me at diagnosis was when I connected with others that have been traveling the journey for some time, and they could help put things in balance and help me. And you don't have to explain yourself how you're feeling in diagnosis. You're able to share. People that intuitively know they've been there. So they probably, to best cope with this, your best people are to connect with patient groups. Now, I know it's a bit hard in the virtual world, but there are closed Facebook groups. You can strike up, there will be advocates, patient advocates that connect with you in the back rooms and private messages. You can also, for example, buddy schemes, for example, at Leukemia Care, I would say are probably invaluable at this stage, when you can get the closest thing to one-to-one connections with experienced patients to help you cope with the double whammy. Yeah. So I suppose that would be my take on it. It's hard sometimes. I mean, I'm 12 years in to actually take my mindset back to how did I feel at the time? Yeah. And I'm mindful of time. But it was when I reached out to a charity the first time to learn how do I communicate with others than my children with a diagnosis, that it opened the door to a lot of other opportunities. And that's one thing we've all got on this call. Yeah. We are connected and we can help each other. And I think peer-to-peer is probably the most valuable resource at this moment in time.
I agree.
Perfect. Thanks, Nick. Anne, is there anything you wanted to add from a professional perspective? I don't know if you've seen anyone who's been diagnosed fairly recently, but anything you wanted to add to Nick's comments there?
I was just thinking, because I'm supporting quite a few people who've been diagnosed since the pandemic, and I think there's something about that question, is how I'm feeling. Is it normal to feel like this for this abnormal situation? And that's kind of, that goes on when first diagnosed and getting into treatment anyway. I imagine it's hard to separate that out. Is that because of this diagnosis? Am I feeling like this, or how do I feel? And is this because we're in the middle of a pandemic? I think the focus for most is actually trying to get your head around the diagnosis and treatment and all that means. And in a way, although it does feel different coming into hospital these days, but as we've heard in Bristol, and certainly where I work, the precautions have been working really, really well to look after our patients. And so at first you're in that sort of like structure and that routine that comes with, usually with treatment and just finding out about the illness. And I echo what Nick was saying about connecting, especially that one-to-one, or the conversations that you have while perhaps you're waiting for clinic or whatever with others. Of course, again, that's more challenging now, because often there are virtual appointments and you don't get to meet patients, fellow patients, in the same way. But I think be with what you're feeling. It's okay to feel like that, and think about what support do I need? What help do I need? What conversations do I need to be having with those close to me? And that even if if you were able to take away the context of being diagnosed in a pandemic, it feels as if your world has been turned upside down anyway. That's what it's like, isn't it? You guys who are diagnosed before the pandemic. And then the dust begins to settle as you become more familiar with this whole new territory that you find yourself in. So I think the pandemic makes it a different and a more challenging context. but the first challenges come with the diagnosis and the treatment and adjusting to that. But you know, we're hearing from Nick and Sam that, you know, this is a process, and you don't stay in that first place in those first months.
No, that's right. I think the one message is it does get better.
It does, absolutely, it does.
Sam, I always like to give one of the patient speakers the last word. So I wondered if there was any sort of take-home messages you wanted everybody to take away in the next couple of minutes before we finish.
Well, we've already come so far, and at the beginning we couldn't see the wood for the trees. We didn't know when we were going to get a vaccine, whether it was going to help people, how quickly they were going to roll it out, what was going to happen. That, you know, we really did not know. It was all very, very uncertain, but the dust is settling and we are heading in the right direction. We've just got to keep that hope going and keep that faith that we will get back to some kind of normal fairly soon. We've just got to keep going.
Great, thank you for that. Thank you to all our speakers. Just before we head off, I wanted to repeat some of the slides I showed. I displayed at the beginning. That was bad grammar there. I displayed at the beginning of the webinar just to make sure everybody knows where there are other sources of support in addition to some of the ones we've already talked about. I think that's really important, especially when we're talking about such emotional issues as these. So just to remind me, of all the other things we provide in terms of information, we've got podcasts you can listen to. So if that's something you use to relax, do have a listen to our podcast. I wanted to point out in particular the next webinar we are running specifically. This one is for CLL patients, talking about living well with the diagnosis of CLL and coping at various stages. So I hope that's of interest to some people listening today. We've also got many more in the pipeline, including treatments for acute leukemia. So keep an eye out for the next few ones coming along. And we've talked a lot about emotional and psychological issues today. So here are some of the support services that Nick has very kindly already mentioned, but we have many different ways you can get in touch with us, and you can get in touch with other patients, our buddy scheme, Facebook groups, online forums, that sort of thing. So please do get in touch if you need any further advice or information about those. I just wanted to take the opportunity to point out our counselling fund. So we can fund up to 6 sessions for those affected by blood cancer of counselling if you are looking for more professional support, and you can find more information about that on our website, but please do consider that. And I'll leave up our contact information for a moment while I say goodbye. Thank you again to our speakers. You've been fantastic, to Sam and Nick for sharing your personal experiences on what is quite a difficult topic to talk about, and obviously to Pauline and Anne as well for sharing their expertise and lots of good coping strategies there. Have a good evening, everybody, and I hope to see you on a webinar again very soon. Bye-bye.
Thank you, everybody.
Thank you.
Take care.
Bye.
Thank you.